Hello, my name is Dr. Farman Ali and I'm a GP and family physician. Today we'll be talking about a very important topic called contraception. So what is contraception? Contraception is basically the process of taking steps to ensure that you do not become pregnant when you have sex. There are many options to do that, and they all have their pros and cons as well as varying success rates. I will be talking about the most commonly used contraceptive method. I'm going to talk about combined oral contraceptive pill, also known as the combined pill. Now, the way this pill works is that it suppresses the synthesis and secretion of the hormones called follicle stimulating hormone, and it also reduces the surge that is needed around the middle of your cycle of the luteinizing hormone. And these two actions inhibit the development of the follicles in the ovaries and hence prevent the ovulation. They also have an additional action by thickening the mucus that is present at the cervix of the uterus, hence making it difficult for the sperm to get in. Another action that it does is it inhibits the implantation of blastocyst, which is a fertilized egg, and hence reduces the endometrial receptivity, which in other words means that the lining of the womb is not as receptive as it should be. So, when can you give combined oral contraceptive and when you cannot give? New moms less than 6 weeks after the childbirth cannot have combined oral contraceptive. Smokers above the age of 35, and if they are smoking more than 15 cigarettes a day, should not have the combined oral contraceptive. Women with high BMI, which is high body mass index. People with hypertension, current or past history of clots, which is called venous thromboembolism. People with heart or liver diseases, a previous stroke or mini stroke, also known as TIA. Women with headache, these are headaches which have focal neurological symptoms, and the ones with aura. Breast cancer, if somebody is having a breast cancer, they cannot have the combined oral contraceptive. Patients with diabetes, it is not recommended to have combined oral contraceptive. So what are the benefits of combined oral contraceptive? They're highly effective, easy to reverse, and very convenient to use. They can sometimes bring about relief in menstrual problems. In other words, if you want to regularize your periods, this is the best contraceptive to have. It may protect against pelvic inflammatory disease. It also reduces the incidence of benign breast diseases, ovarian cysts, and there is a protective factor for ovarian and endometrial cancers, which is cancers of the lining of the womb. The problems that we face with this combined oral contraceptives, some side effects include breakthrough bleeding, which means bleeding in between your cycles, breast tenderness, mood swings. There is a slight increase of clots being formed in the legs or going to the lungs. There is a slight increased risk of myocardial infarction, which is heart attack. This is more pronounced in women with other risk factors such as smoking, high blood pressure, and diabetes. Possible increased risk of stroke, especially in those women who have migraine with aura, and other factors which may influence the risk factors. Slightly increased risk of breast cancer, but this is more pronounced in women above the age of 40. Hence, it is safe to be taken in women under the 40 years of age. There is a possible risk of cervical cancer. However, this may be related to other factors. For example, having multiple sexual partners, having unprotected intercourse without non-barrier methods, and exposure to human papilloma virus. Thank you very much.